Hi. You are now about to learn how to empty your bladder with an intermittent catheter. Catheterization is a way to empty your bladder regularly with the help of a little plastic tube called a catheter. Your body produces urine which goes down to the bladder. The bladder looks like a balloon. It is small when it is empty, but it grows in size when it fills up. When it is full, it is time to pee. The pee goes out through the urethra. If you cannot empty your bladder the regular way, you can use a catheter. It is a plastic tube with holes on one end and allows for the urine to come out. Your doctor or nurse will tell you how often you will need to empty your bladder based on your personal needs. The catheter has a special surface that gets very slippery when it gets wet. Some catheters need to soak in water for a short while, and some are ready to use and have water already in the package. Your doctor or your nurse will show you how your catheter works. First, bring out the stuff you need for your catheterization. Your catheter and maybe a towel. Make sure you have enough light in the room since you need to see clearly what you are doing. Wash your hands thoroughly with soap and water. If you are using a catheter that needs to soak in water, it is good to prepare it before you pull your pants down. Find a comfortable position, either standing up or sitting down. Some women and girls find it helpful to tilt their pelvis a bit forward. You will soon find the position that works best for you. Spread the opening and lift it gently upwards with your fingers. You should now be able to see the opening of the urethra. This procedure can be easier if you use a mirror. It's important not to touch the catheter surface to avoid bacteria going into the body. Slowly push the catheter into the urethra until the urine starts to flow. Make sure the funnel end is pointing into the toilet. When the urine starts to flow, push the catheter 1 or 2 centimeters more to make sure it is completely inside the bladder. Take time to completely empty your bladder. It is important to make sure that all the pee comes out. You can then throw your catheter away. Emptying your bladder regularly is an important part of staying healthy. Self-catheterization will help you and will soon be a natural part of your everyday life, not only in your home, but also when you're out and about.